During the first trimester of pregnancy, several important lab tests are typically performed to ensure the health of both the mother and the developing baby. Here's a simple breakdown of the common tests. Blood test. The purpose is to check for blood type, Rh factor, and anemia. Knowing the blood type helps avoid complications during delivery. Anemia, or low iron, needs to be managed for the mother's health. Complete blood count, or CBC. The purpose here is to assess overall health and detect disorders. It helps identify any infections and ensures that blood cell levels are normal. Urine test. The purpose is to check for protein, glucose, and signs of infections. This test can detect signs of urinary tract infections and assess kidney function. Alright, so let's talk about the HIV test. The purpose of this test is to check for the presence of the HIV virus. Now, why does this matter? Well, early detection allows for treatment that can prevent transmission to the baby during birth. Next up is the syphilis test. The purpose here is to check for syphilis infection. And you know, if syphilis is left untreated, it can seriously affect both the mother and the baby. So early treatment is really crucial. Alright, let's talk about the hepatitis B test. The purpose of this test is to determine if the mother is infected with hepatitis B. And well, why does this matter? If the test comes back positive, steps can be taken to protect the baby from contracting the virus. Now, moving on to genetic screening tests. The purpose here is to assess the risk of certain genetic conditions, like Down syndrome. Why is this important? Well, it helps parents prepare and make informed decisions about whether they want to pursue further testing. Next up is the nuchal translucency screening, which is usually done by ultrasound. The main purpose is to measure the fluid at the back of the baby's neck. Why it matters is increased fluid can indicate a higher risk for certain conditions, such as Down syndrome. So, you see, these tests help ensure both the mother and baby's health, allowing any issues to be addressed early. It's really important for expecting mothers to discuss these tests with their healthcare provider, so they can get personalized guidance and support.